Welcome to Empowered Ease. I'm Jen Olinger. This show exists to challenge the patriarchy by celebrating women who help others in their way and in their time. Women who choose slowing down, self-love, and honest inner work over hustle culture. Beginning now, Empowered Ease will release new episodes twice a month on Mondays. Each episode brings you a powerful woman, a leader, a healer, a parent, or a caregiver, who invites us to pause, go within, and ask, who am I? What do I really want and need? We slow down together, we learn practical tools, and we reclaim our permission to rest, to receive, and to shine. So thank you so much for joining me. Please like, follow, and review the show so that you never miss an episode, and also because it helps us to continue to grow. So welcome to Empowered Ease. Podcast. This is season 2, episode 5, and today's guest is someone who lives and breathes whole family, whole body care. Nicole is the co-owner of Abe Feeding Clinic. She's also an integrative oral functional therapist, a licensed speech language pathologist, an international board-certified lactation consultant, a myofunctional therapist, and a craniosacral therapist. She has dedicated her adult life to understanding how the body and oral function are deeply connected, how feeding, breathing, and oral development can impact everything from sleep to posture to overall health. What makes her work so unique is her gentle, integrative approach. She weaves bodywork, orthodontics, functional medicine, and medical providers to offer truly comprehensive support. Nicole works with patients across the lifespan, newborns with complex breastfeeding challenges, toddlers with airway concerns, school-age kids with tooth crowding and oral dysfunction, and adults dealing with TMJ pain, head and neck tension, and also snoring. Her journey began with 2 tongue-tied infants, inspired by her own feeding experiences with her own babies, and now she has expanded to caring for entire families, because not all oral ties are caught in infancy. Outside the clinic, Nicole is known for her big, beautiful family, her deep roots in her local parish, and self-sufficiency lifestyle that includes homeschooling, caring for her animals, collecting honey and eggs, processing meat, and cheering her 7 kids on from the sidelines of various sports. Faith, family, and serving her community are the heart of everything she does. Nicole, I am so excited to have you on the show. Welcome. Well, welcome, Nicole. I'm so excited to have you here. So, reading all of these lists of things that you are with the integrative oral functional therapist, licensed speech language pathologist, all these lactation consultant, myofunctional therapist, craniosacral. How do all those fit together, and what does all that mean?
I think a lot of people look at that and they're like, "Oh, you do all these things," but that's not true. The way I've added all of my different skill sets, if you will, over the years have really just helped me to laser focus on what I do.
Okay, so basically you're focusing on the babies and the swallowing, or all of that just related to swallowing?
All of it related to, oral function, and it's such a bigger picture than that.
Okay.
And it allows me to see what's going on, but not get lost with all the other things that are factors.
Okay. And, so you take these and you focus in on the education into your practice of oral function.
Right.
Okay.
Oh, like you hear the phrase, if all you have is a hammer, everything looks like a nail.
Mm-hmm. Yes. Love it. Okay. So you got into this because you had 2 babies.
Well, I have had 5.
But 2 that were tongue-tied. I thought you had 7.
So 2 stepkids.
Okay. Yeah. Okay. So you have 7 total children. You've had 5. And how many of your babies were tongue-tied?
Like all of them.
All of them. Okay. So tell me what that is, how you figured that out, and how that got you into this.
It was my second one was definitely the catalyst. I was young, older, but young in the field, new in the field as a speech pathologist in pediatrics.
Okay. So you already had that going for you.
Mm-hmm.
Okay.
But never in swallowing, you know, it's like, you don't learn that in school. It's one of those things that they don't teach that, or they do, it's like a 1 day long class,
Okay.
you know? So you really have to do a lot of continuing ed in order to be a feeding specialist, regardless really of the age, but especially pediatrics. And so I ran into so many issues feeding him and not even knowing that he was tied. I just knew that we were struggling and I was in a lot of pain, and I was in rural Missouri and there was just nobody there to help me. And, you know, we figured it out. Eventually he had a lip tie release, and there's a long story to him. What's pretty cool about our podcast that we do is one of our episodes is dedicated solely to that. But what I realized, and really how I always think, is like, I can do this. This is in my scope of practice. I just don't have that skill set yet.
Mm-hmm.
And so he was definitely the catalyst, and he is 12 years old now. So he was the catalyst that sent me into lactation, because I really just wasn't finding much of anything in the tongue tie world as a speech pathologist. Like, it exists now more in our field, but it was talked about so much more in lactation. I'm like, okay, well, lactation, obviously there's a lot of components to it that are outside of the infant. But when it comes to a breastfed baby, speech pathologists at the time knew nothing about them, you know? So we could never take the breastfed baby and apply the knowledge that we had for swallowing, because it's just so dynamically different. And there's just so many variables that I was like, okay, well, as a speech pathologist, I'm going to learn about pediatric feeding, and then I'm going to get lactation trained. And eventually that led to me becoming an international board certified lactation consultant long before it was popular. I mean, it was only 5 years ago, but the speech pathologist becoming a lactation consultant is becoming more trendy now, because more of us understand that we need to understand both.
I was going to say, but it sounds like what a great,
Oh
they
my
seem
God.
naturally, right?
They really do. And then, you know, you go to the hospital setting and those two fields are fighting each other when you could just work together.
Yeah. Yeah. Most of my experience with speech is I've been a neuro ICU nurse. So it's always like stroke, swallowing after a stroke. So that's a lot of what we do. I would never in my world connect all these things. So before we get past this, I do want to ask you, for people that may not know, because I don't think I know exactly either, what does tongue tied mean? I think there's probably different ways to be tongue tied, but what does it mean when a baby's tongue tied?
Yeah. And there's more than just the tongue. You know, we can have tethers. We just call them oral tethers, would be like a generalized term. So it's structural restriction. So we have we have frenums in the body, much more than just the mouth. But one, you know, obviously that I'm working with is going to be the lip, the buccals, and the tongue most frequently. And so when somebody says tongue tie, you know, they might also be referring to another tether, but it's structural restriction, and it's something that happens in utero that is supposed to happen and doesn't. So it's called apoptosis. There's like a ton of information on it, you know, and so that tissue is supposed to basically go away, and sometimes it doesn't. And
my husband has extra tissue in the roof of his throat, and he there's certain foods he won't eat because he has stuff will get stuck there. He hates it. And I'm like, he's tongue tied, but he doesn't even know it.
He could be. Well, and that's kind of how I got into working with adults too, and older kids, because not everybody's caught as a baby. We love working with babies because can we resolve all of these issues and get optimal breastfeeding, because that is what leads to so much success in growth and development, neurologically, structurally, all of these things. And so not everybody gets caught. So it's super common for me to be working with a baby in a family, and dad's in the corner, shrinking a little bit. Oh, that's
oh shit, that's me.
Or I'll start, some families not to get a release too, which is fine. And we can kind of talk about what that means later too. And we definitely support families, or I have always very much supported families to be hey, if you're not comfortable with this, I totally understand. We're going to make feeding work the best we can, whatever that looks like. Now, these are the things you want to look for as your baby becomes an older child. That might lead to us needing to revisit this, or at least just checking back in with me, because Like, we don't want these things to get worse. So it's so common then as I'm talking about those symptoms, and I'm working with a baby and a mom, and they're like, oh my gosh, that sounds like my 4-year-old, or that sounds like my 7-year-old. Like, bring them in. When we're done with baby, bring them in. The amount of whole families I see is, I don't know, it's pretty significant. And it's not uncommon for me to be like, see a dad and a daughter, or a mom and a son, or
how does it manifest in like in ages that aren't babies that they would know?
The biggest thing I work with as a myofunctional therapist, so that's just what that is specialized training in oral and facial and really even neck and respiration. I mean, it kind of all gets tied together. But as a myofunctional therapist, you're working with an older child, generally speaking, somebody who's going to be able to follow directions. Like, we're not doing myofunctional therapy on a baby. We're working on oral function for swallowing, for speech, for breathing. But what I'm seeing usually at like the 4-year-old age is going to be enlarged tonsils, because a lot of those kiddos are also mouth breathing. A snoring child, you've got a noisy breather, you've got a kiddo that has symptoms like maybe is actually sleep disordered breathing. Yeah. So that, and then like 7 and 11 is like the next two age ranges I see a lot that are usually it's dental crowding. Like that's okay, we're getting ready for orthodontics because they have a really narrow palate and there's not enough room for their teeth. So now they're going to go see the orthodontist. But the reason of why they have a crowded mouth, or like their teeth are crowded, is because oral function was impaired for one reason or another. Whether it was there's other reasons too.
Interesting. I'm learning so much. I had no idea about any of this stuff. I love it. It's so interesting.
Yeah, don't. But it's a different population. It tends to be just more pain, because like when you have dysfunction all of your life, it leads to chronic migraines, head and neck pain, snoring, grinding your teeth, all of the things that just lead into hurting.
Interesting that they could all have related to this kind of issue. Is there any like myths or misunderstandings that come with this kind of work?
Absolutely.
Like what?
If you release your tongue, your throat's gonna, or your tongue's gonna fall back in your throat.
Oh, interesting.
Or it'll stretch out, and it doesn't. Tissue, like think kind of tendinous tissue. It's really fibrous.
Oh yeah, it usually gets tighter when you hurt it, not looser. That's the very end.
Exactly. And like that's the difference between being able to loosen up fascia. So like that's such a huge component of working with any age, is we want to make sure that the fascia is as receptive to change as possible. You obviously need more, and bodywork is obviously a component. Like when you read the list of all the things that I do, I'm also a craniosacral therapist. And that you see even more rarely, especially in the speech pathology world. I've been doing that for almost 12 years now. And that was brought on, 11 years. That was brought on by my third son. And so what I love about craniosacral therapy is I'm able to help bodies, regardless of the age, release tension that might be inhibiting them, that might look like a tie. Because it's not always a tie. There can be restriction and there can be dysfunction that's actually not a tie. So it helps to be able to like filter out those different components that, like I said, if we go back to the hammer and nail, if you think everything is a nail, or if you're a hammer, everything looks like a nail.
Okay, so sorry, my dog is whining at the door. She's such a little turd. But so what kind of, when you're working with people, is those like hands-on? Are we doing like, what kind of things are you doing with people to help with these issues? What does that kind of work look like? And even with babies, what does that look like?
Yeah, it looks different for each age population. I specialized in infants for a long time. And what's really fantastic about the team that we've built is we've also trained our providers to also become really dynamic in being able to utilize bodywork or be therapists and lactation consultants, so I don't treat babies as often as I used to because we have a really, really good team. And so whenever somebody's like, hey, I need my hand, I need your hands on this baby, or I need a second opinion, or I'm struggling with this baby, that's when I'm going to be seeing those babies. And then we don't have any other myofunctional therapists on our team right now. Hopefully we will at some point. And so then I'm seeing the adult population and the older children. And so myofunctional therapy with child and an older adult will also almost think PT for the mouth, the face and the mouth. That's kind of like that.
Okay. So you're giving them kind of exercises, things to do at home and continue. Okay.
But like the way that I'm different from any other traditional myofunctional therapist is that I incorporate bodywork. And so it's really common to be like, oh, okay, you can't do this, so do these exercises. But I'm going to look at it through another lens of being like, okay, you're really working under a lot of restriction because of this much tension. Let's resolve some of this tension. Let's soften things and then slowly build you up with less exercise because you're not working around other tension patterns.
Okay. So what is like, so if you are to find out this is you at an older age, because I'm reading like things like TMJ, pain, snoring can all be from oral issues. What are people's options? So like this kind of work, when you were talking about releasing, what is that kind of, is that only for babies, or do adults find ties and get them released?
I had my tongue tie release at 36.
What is that like? Do they go snip it? That's what I'm imagining, like a surgery.
So it's with a laser. So our best providers, I'm not married to any specific laser or tool because, to be very fair, you can have a release provider that uses a scissors and does a beautiful job, and you can have a provider that uses a really big expensive laser and they do a terrible job. So just making sure that you're working with a provider that's very skilled and knowledgeable is what you want. But most often we're working with release providers that are most commonly dentists, and they've done a lot of extensive training because most dentists really aren't taught anything about the tongue. So don't be surprised when you go to your dentist and say, I think I have a tongue tie. And they're like, that's not a real thing.
Yeah, because you'd think he would have told you before now.
Exactly. Or why are you grinding your teeth? Or why do you have all this? Yeah. Why do you have TMD? So why don't you have TMJ dysfunction?
Yeah.
Unfortunately, just like the speech pathologist world, there's not a ton of training in ties. And just like in the medical field, whether it's dental or it's physicians, they don't have a lot of extra training in that unless they really specifically seek it out, which those of us that are in the world of oral dysfunction have really sought that out.
So if someone is listening to this and they're like, this is maybe like, maybe this is what's going on with me. Like, are there any other signs, I guess, before I ask you this question, are there any other signs people should look for? Like, I mean, I know I said my husband has like an extra piece of skin he's aware of. I don't think he knows what that means. He just like lives with it. But are there other things like that people just have that maybe they've like gotten used to?
So the biggest thing like with babies is just difficulty feeding. Like if there's ever difficulty feeding, and it doesn't matter if it's breast or if it's bottle, like you want to find somebody who is a local skilled provider. And trust your gut as a parent, regardless, trust your gut. Because there are so many people that I work with are like, I said this and we ended up bottle feeding because we couldn't make it work. And I thought that's what was going on, but I just kept getting told that's not a real thing, or it'll stretch, or it'll break on its own, or it'll get better with time. And it just never did. It's the same thing with picky eating because I
was going to ask you if picky eating was a sign, because his son is a super picky eater. And so in my head, I'm like, have we ever really looked in his mouth?
Well, it's totally possible. There's so many different layers to like why somebody might be a selective eater. Sometimes it's how it smells, how it looks, how it tastes, but how it feels.
And his is a lot of sensory.
Exactly. And like, so in like my very first pediatric feeding training was more sensory based. And I think it's so important because if you don't address the sensory component, like you can't even get to the motor component because like they don't want to look at it. So
yeah, they're like already done. No, thank you.
Right. Exactly. So that was really like a key component into like learning like, oh, there's a lot of reasons why somebody chooses not to eat. Cause it's a choice in the sense that like I don't want to, but there are things happening in the body that make them truly not be able to as well. And so sometimes selective eating comes from the inability to be able to control that food, which is where feeding therapy and myofunctional therapy come into play. Sometimes that dysfunction is because the tongue is tied and it can't move the way it needs to hold the food in their mouth in a safe way to swallow. So then it becomes really unsafe. So it's super common for like little kids to like always have their hands in their mouth when they're eating because their fingers are using the job of their tongue. Or
so they're trying to like control the food.
Yeah.
Interesting. These are all things that you would totally note. Like moms are probably like, I know that kid.
Yeah, exactly. Or like the open mouth chewer, the kids that like super messy and food's everywhere, or like you can't sit at the table.
Yes.
Right. Like, oh my gosh, will you just close your mouth? Like that sounds horrible.
Yes. I can't think of a specific kid, but I know exactly what you're saying where they're like breathing, open mouth breathing while they're trying to eat. Yes.
Exactly. And now could that be a tie? Absolutely. Could it be sinus stuff that's happening and they're literally physically unable to breathe through their nose? So they've got to breathe through their mouth when they're chewing or swallowing or sleeping or at any time. So that's why I work so closely with other types of providers. And that's also what I love working with middle, age children, even in adults, is like, I'm open mouth breathing at night, but I can breathe through my nose during the day. What's going on? Or I can't breathe through my nose at all. I'm like, okay, we're going to ENT. You need to get scoped and figure this out. Or we are capable of nasal breathing and we've just created this habit where it's really hard to breathe through your nose because it's kind of like this use it or lose it type of situation. What happens with kids as they're growing, if they're not breathing through their nose, it affects their health. It enlarges their tonsils. It makes breathing harder in general. And then it also is affecting their face and their shape and how they're breathing in their teeth.
Interesting. Well, great. Well, dude, I had a physical therapist on here at one point. She specializes now in like pelvic floor therapy, but we were kind of talking about how like your shoulders are actually like connected to your breath. And like, like it's interesting how like one small thing at the beginning of your spine, like one misalignment up here affects the whole thing.
Well, exactly. And like when it comes to pelvic floor, all diaphragms are connected. So if we have in the diaphragm, which is the floor of the mouth, it's really common to have tension in the pelvic diaphragm as well.
I wonder how common anxiety is in these people too, because that's like the beginning of your vagus nerve. So if it's stimulated, then you're anxious all the time. You know what I mean? I'm like, my husband and his son are anxious creatures. Like,
exactly.
Go after this episode. I'm like, everyone's getting checked out.
Right. And our tongue is not properly stimulating the roof of our mouth to like with full range of motion. That affects our accessory muscles, which also causes tension in the neck, which also affects our vagus nerve, which then affects our nervous system. So are we
and our breathing and everything falls in line with that.
Exactly.
Interesting. How cool. I mean, just, like this whole circle thing. It's all the like holistic stuff is really true when you get down to it. And then like when you live with these chronic things, then you start adding more problems. If you can get to the root, you can do a lot of work. I love this. So you have more than one clinic, right? You have a couple locations?
We do actually have 3 locations. So our primary location is in South County. Hi, baby. This is my youngest. He's about to rip all the cords out so he can come see me. He comes to work with me every day.
Oh, hi, baby. I love it. Modern woman taking the babies with her. Hi, baby.
Right? Do you want to take him? You stink.
You're very cute. Very cute.
Thank you. He's in most of our podcasts too.
I love it. That's where they should be. I know my dog usually lays next to me, but I didn't give her enough time to calm down, so I kicked her out.
Oh. Yeah, so our primary location is in South County. So we've got a pretty big feeding clinic right there, right off of 270 and Gravois. And then we opened up another location down in St. Robert, Missouri, right outside of Fort Leonard Wood. And then we also have a space inside the New Mom School in St. Louis, in the city.
How cool. How cool. So if someone's listening to this, okay, well, me and my questions here. So is this kind of thing available other places? So people that might not be in the St. Louis area?
Absolutely. Yes. Yes, okay. There are.
So this, you just have, what would they look up if they want to looking it up?
So you might be more likely to find individual providers, maybe a lactation consultant who is also a craniosacral therapist. You might find a speech pathologist that's also a myofunctional therapist. You might find OTs, speech and PT that are doing body work or they're doing oral function. You know what I mean?
Okay. So looking for people that have like a mix of skills in this area so they can really have an understanding.
Exactly. And there are different like websites that you could go to. Like UpLedger is who I'm trained with for craniosacral therapy. So you can find a wealth of providers like across the world who are providing. And
By
you can
starting there, that's smart.
trained or how extensively they're trained. Like, are they trained in pediatrics or not? Because you don't want to go with somebody who's a visceral therapist, working on the organs for your baby.
Right. No. So that's cool. I love that. Okay. That's great advice. So if someone's listening, they're in the St. Louis area and they're like, we're going to come check you out because someone's struggling. What can they expect at the clinic?
Like the whole,
like the experience, like what it, like, what's going to happen? Like they should just like call you up, make an appointment, come like, is it hands-on? Are we doing an assessment? What kind of, like, what are the options of who they might see?
For sure. And we just live in the world of a lot of texting. So texting works for us.
Love it. That's very functional for most people. Nobody wants to talk on the phone. I don't.
Ew, I don't like it.
I don't either. I dread it.
Isn't that funny?
Yeah.
Yeah. So, and also people can go through our website as well. You can do like an inquiry. And even if you do like an inquiry for one of our locations as well through the website. But yeah, and I know on the bottom of the notes that we'll have all of our links.
Yeah. So, I'm going to put all of them on there.
You get a hold of our office and honestly, she's going to talk to you and find out what you need. Okay. That's the really great thing is like Jill is going to be like, hey, what's going on? Tell me what's going on. Sometimes people are like, hey, this is what's going on. I know this is what I need. And if you don't know what you need, all you have to do is tell her what's going on. She's going to know exactly who you need to see and what you need. Okay. And even personality wise, like we just have different providers that we all have a different vibe. And it's super common for our patients to see multiple providers just because we all do have very different skill sets and strengths. And sometimes you might be with Rachel, who is just so incredible with our brand new babies. And then you're going to move on to Teresa, who's our IBCLC dietitian, because we've got some gut stuff going on.
I love it. You guys got a bunch of different people there. Yeah. So that's great. So you're not like just chopping around trying to find, that's great.
Under one roof. Exactly. And that's the goal. And, we've got a physical therapist who is an incredible body worker. We've got a massage therapist. She doesn't do traditional massage. She just does craniofascial therapy and craniosacral therapy. We've got OTs, PT, speech, dietitian, massage therapist.
Oh my gosh, how cool. This is so cool. I hope this catches on more places because what a great service.
Well, and that kind of speaks to, I've never been a person to stay in a box or be in the norm, and that's kind of what brought me from the middle of Missouri to St. Louis, because when you're in a more, I don't want to say narrow-minded, but just limited resourced area, it's so much, the Midwest is just slow to acquire things.
Oh, yes. And from someone who's lived on both coasts and is from and returned to the Midwest, I totally understand what you're saying.
Like, I love the Midwest.
But we catch on way late to the game in a lot of things.
Exactly.
So health-related specifically.
Exactly. So when I started working with a chiropractor, this was with my third baby. And so I was in Rolla, Missouri, which is my connection down to St. Robert, which is why we're down there. So that was when I was already a speech pathologist and lactation because I was a CLC. I wasn't board certified. And I started working with this mom and baby chiro who was amazing. And she was a homeschooler. She had a thriving practice in her basement. And it was just like, oh, I love this. Well, she moved. She had the audacity to move, but we were working together and we had figured out that we could literally treat babies at the exact same time and it would help both of us.
Aww.
And what we did was so incredible. And she would do cranial work as I was assess suck. And I'd be like, there it is. That's it. Like, you know what I mean? So like, I don't know if you're familiar with cranial work, but it's really light movements and babies are so easily manipulated. And, I mean, they're mushed through the birth canal and sometimes
Yeah.
birth causes trauma and
Yeah.
alignment that affects feeding, like you said with the vagus nerve, like all of that's interconnected. And so when we have tension patterns or trauma associated with something as simple and complex as birth, that's why we can still have feeding issues with babies, even though they have this perfect goal birth, we still run into these issues. And so I was working with this chiropractor and we're grooving and we're found that like when we work with each other, these babies are just flying and they're off. You know what I mean?
Aw.
We could work quickly and then they were where they needed to be and they could be nursing with mom. So then she moved and I'm like, what do I do without you? And she goes, go get CST trained. I was like, what's CST? Like, I don't know what this is. And so I looked it up, found it. I think she probably sent me the link and signed up for it immediately. And I went and I was like, oh my gosh, this is incredible. This is really weird. Like my speech medical self is like struggling with some of this stuff, but like, I think I'm home. I think this is it. And the more training I got, I was just like, this is life. Like we don't have to work harder. We can
Smarter.
exactly. We can facilitate healing because the body wants to heal.
Oh, I love that. I love that. I know we just have to learn how to listen, really. But it's the magic of figuring out how to listen. I love that.
And that's the biggest thing about craniosacral therapy. And I even incorporate it into all my assessments, or almost, depending on what's going on, is my hands can listen. They can tell me things that my eyes can't tell me.
Yeah, that's so cool. Okay, so for parents that might be listening, thinking like I'm having my child's having feeding, breathing, sleeping issues, some of the things. What are some red flags that like maybe they should not ignore, and maybe some like green flags of like that's pretty normal, don't freak out.
Green flag would be like normal picky eating. That's like, I don't like that today. And then next week they like it. Like that's
Okay.
normal.
Okay.
That's normal, right? Noisy breathing at any time, genuinely, and snoring especially is going to be a red flag, massive red flag.
Okay.
Yeah. Restless sleep. You think about your kiddo, regardless of the age, that's either like hanging their head off the bed and sleeping in crazy positions, or you put them to bed in one position and they're like spinning around and the blankets are gone. That kid.
Yeah, the one where they end up with their head at the foot of the bed. Yeah.
You can't find them in the morning, or like really frequent waking. Of course, I mentioned snoring, like those components. That's going to be a red flag for airway. It's not
Okay.
always airway. There are other components to that, but that's usually one of the biggest things is airways. They're having a hard time breathing and they're having a hard time getting, like we said before, like in rest and digest because there's dysfunction.
How interesting. Okay, I love that. What great advice. Okay. What else do people need to know from you from listening to this?
I think one of the biggest messages that I can take to anybody with so much experience of working with these families that trust your gut.
I love that. I love that because I feel like that's what a lot of us are trying to teach people to do is like learn to listen to their gut because there's so much information there when you can learn to listen. What great advice.
And when you get told that that's like normal, or you're told like, don't worry about that, but it's just not sitting right, just find your people. Oh my gosh, find your people.
Oh yeah, we've given that advice a lot too. If they're not taking you seriously and they are professional and they're not like giving you that respect, they're not your people.
Exactly. And like that is our team is going to listen to you. And most importantly, not only are we going to listen to you, we're going to take your goals seriously. And it doesn't, I don't care what your goal is. That's what we're going to do. And we're going to adjust if we have to, because mental health is such a component. Like if it doesn't feel right to be exclusively breastfeeding because this is something you can't handle and you need to lighten the load, we lighten the load. It's not an all or nothing thing. You know what I mean? It's just like, and I
What
work with,
works for you? That's that whole holistic approach. What works for you? What works for your life? What works for your family?
well, and like you said there, what works for your family, like that goes into feeding therapy or even myofunctional therapy. Like would we love for everybody to sit down and prepare a meal all together every single night and sit around a table and have a family style meal so you all get that social exposure to food and all these wonderful things? Yeah, that's
Sounds
gold.
nice. Yeah.
Not stick, right?
Yeah.
A family that like you're just always on the go. Well, we're going to have to figure out this feeding therapy goal that's going to fit for your family
Yeah,
and your
this is a fast-paced world. People rarely make time to sit down and do that anymore. It's a very good, good
like,
point.
yeah. Yeah. And it's just like what we make it work. It's just life. You know, I'm a mom of so many kids and it's just like,
And animals and chores.
yeah,
It sounds like I love it. It sounds so amazing.
you got to be realistic. You genuinely just have to be realistic about your, not just your goals, but like how you're going to do these things. Like I'm not, as a myofunctional therapist, I'm not going to give you 10 exercises to do every single week and come back next week so I can give you 10 more. I despise that approach, to be very honest.
Well, because it's setting you up for failure. And that's like, you got to set yourself up for success. Baby steps here, people.
Exactly. Less is more. Less
Oh,
is,
I love that. I love that. Well, so I've loved this. Absolutely loved this. I wish we had more time to talk about your personal life because that also sounds interesting. But so I ask everyone that comes on this, but what is your like go-to when things in your life get overwhelming, get stressed? What do you do for yourself to bring things back?
so my faith is what's going to bring me, keep me connected and rooted for, and body work. My body workers, my energy workers,
Yes.
like really, because I give to people so much, not just
Yes.
to my family, but you know, clinically speaking, I give to so many people. So, and if any other providers are listening, like you've got to give to yourself too.
Yeah, that's such great advice for people like because I know I'm a nurse, so I have a lot of nurses that listen to this, and that's like a good way to think about that for yourself. Is like you're always giving so much of yourself. At some point, you have to allow yourself to start receiving. Which is the last time I had Reiki with this awesome hands-on lady. She told me that my giving hand is over giving and my receiving is down, and I need to receive more. So, but that's true. I love that. I love the way you phrase that though.
Well, and I've listened to some of your stuff, and so it sounds like you kind of had an experience where you ultimately couldn't give anymore.
Oh,
Right?
yes. I got burnt out so bad at one point.
Yeah.
Yes.
And so like if we can start to have healthier boundaries and respect that I'm doing too much or I'm giving too much or, you know, trying to live in this lifestyle that always has everybody, like you said, in burnout because that's the expectation. It's bullshit.
Right. Yeah, oh, yeah. The hustle culture that we're in right now, like be
No.
everything to everyone, be the perfect mom, like do everything. Like you do a lot of things, but it doesn't sound like you put the same pressure or the same shame on yourself. That is really what's killing us all, I feel like. And that with breastfeeding, especially, that's like I know we're changing our mind, but there's a lot of shame involved in that. And even I've heard people horror stories about lactation consultants.
Oh yeah. Oh yeah. It's about that. Yeah.
Yeah.
No. Yeah, absolutely. I don't know. I think imperfectly perfect, right?
Yeah.
Like we're all perfect and we are so imperfect. Like stop putting all of and most of it, like especially as women, is there's just such strong innate drive to do more and be more, but we don't need to be.
Right. We give a lot of that back to ourselves. I love that. This year, I've been like really trying to try a lot of these like adjunct kind of therapies. And I love that because that's what like you're combining all this stuff to me. I'm like, that is like health is finding all the little things that work for you. And they're not these huge shifts, they're small little shifts. And then, and that changes over time, but finding the things, the people that work for you in your way. So like with your family, with your kids, that's the same thing moving forward, right? How are we going to work with them in a way that works for their issues?
Exactly. And honestly, and if we can raise our kids this way, we're only setting them up for more success as well.
Right. Right. Yeah. With that, like outside these rigid standards, like letting people be people and learning to work with that. I love it. It's so beautiful. It's like what we all need a little bit more of.
Yeah, absolutely. No question about that.
This has been so awesome talking. I absolutely love it. I love what you're doing. Anything else you want to share before we're going to put all the links to all of her stuff in the show notes so you guys can find it. But anything you want to share on here, or for people that are just listening that don't want to like get on here and find the links, an easy way to find you?
Oh my gosh. Our website is www.abespeechandfeeding.com. You can also find us on social media. Like, I'm super bad at remembering all these things, but the Feeding Baby STL is one of the things that, like, if you're ever like, hey, oh, that's easy to remember.
Yeah, Feeding Baby STL. Okay. Abe is spelled ABEILLE, and I butchered how to say it.
I say it's really perfect. Yeah, there you go.
There you go. Yeah, that's right. We're human. It's okay.
Human. I'm about as human as they come. But
oh gosh, me too.
It helps people feel more comfortable coming and being like, oh my gosh, you're not messing up. You're coming here because you know you need help. You know?
Yeah.
We're all struggling.
Isn't that the truth? I love that. I saw this like thing where Obama was talking about that recently. He's like, you think all these like super high up people are so smart, and then you get in a room and you sit at a table with them, you're like, these are not special people. He was like, they're just like you and me. So I love that, because it's like, it's true. We're all flawed, insecure.
Right.
Do the best we can with what we have.
Exactly. Exactly.
Well, thank you so much.
Season 2. Yeah.
Yeah. Well, I've really appreciated you coming on. We're going to have you back on just to tell us about your homesteading lifestyle. I called it that. I don't know if it really is, but I'm like, it sounds like it. You do so much cool stuff. So, or anytime your clinic is doing an event, I would love to hear about it. This is so awesome. So
thank you for having me.
Yeah. Yes. I hope you have the like best rest of your evening.
Thank you. It's going to be with the kiddos.
Yay. I know I'm going to go get my whining dog from under the door and give her some love.
Good. All right. Thank you for having me. I appreciate it.
Yeah, you too. That's a wrap for this episode of Empowered Ease. I hope you were inspired by today's guest and felt empowered by their story. Our listeners have been growing, and I am so thankful. Welcome. You can aid in that growth by helping us by liking, subscribing, and leaving a review. I'd love to hear your feedback and suggestions for future guests and for how you are empowering others in your community. So until we meet again, keep challenging the norms and empowering those around you.